Thank you so much to the MPO for the opportunity to actually talk here today. Yeah, my computer has been giving me problems this morning. It just keeps restarting. So if I suddenly disappear, then you know what is happening, and I will try to get back online as soon as possible. Technology is not always our friend. So yeah, thank you, Cordelia. Cordelia has mentioned I work for Zoetis. We're an animal health pharmaceutical company. So I just want to start my timer so I can keep up with how long I'm talking. And I am a veterinarian by trade. But yeah, as Cordelia has mentioned, for the past 6 years, I've been a technical manager for Zoetis. So what we're going to talk about today is udder health and mastitis. So when you do talk about udder health and mastitis, I think it's very important to also just understand udder immunity and how the udder actually responds to pathogens from the outside and how that leads to mastitis. Okay. So the basics of the immune system, if we look at the basic components, that can be broadly broken up into 3 principal components, right? So you have your physical barriers, and we're going to talk about all of these in a bit more detail, except maybe the specific adaptive we're just going to brush through. But so that would mean your teeth, skin, the udder environment, the teat canal, and how that actually physically prevents pathogens from the environment entering the udder. The keratin plug we're going to talk about. And then non-specific immunity. So that would be, in case of the udder, that would be your somatic cells, that would be all of the cells that go into the udder, that enter the udder when there is a bacteria or a virus or whatever that is present in the udder, and how that then fights the infection, right? And then your specific adaptive immunity, so your non-specific immunity, that would be your white blood cells that are circulating, that are always there. I always call them the soldiers because they are constantly going through the circulatory system looking for foreign pathogens, right? Your specific or adaptive immunity, that would be your cells that... Okay, I think someone's not muted. So that would be your cells that, for example, your immunoglobulins, where there's where it fights a specific pathogen. All right. That are also your memory cells. In other words, where the body's immune system can actually recognize specific and remember specific infections, and then fight those infections very specifically. Right, so when we look at the udder, usually it's quite sterile, but when the pathogen manages to enter, that is when we see infection, and that is when we see inflammation, usually. Right, so I've spoken about those physical barriers, in other words, that first line of defense, right? And those include the teat skin, the keratin plug that can seal that teat duct or teat canal, and then the teat sphincter at the end of the teat canal. All right, so let's look at, I'm just going to move this. So let's look at the teat skin, right? So usually when it's intact and well cared for, it's quite hostile for bacteria. Reason for that being is that it's composed of a layer of dead cells containing keratin. This is quite a waxy substance, so it doesn't support bacterial growth. And there are also skin secretions that have a bacteriostatic effect. However, if there's any damage to the teat skin caused by cuts or cracks or chapping, warts, or any types of lesions, this would then create an entry point for pathogens to enter the udder. Okay, so the keratin plug. So if you look at the anatomy of the teat canal, they are usually, it's composed of numerous longitudinal folds, and these are all lined with keratin, and they sort of form an interlocking seal. When the animal is being milked, a lot of that keratin or any of the organisms or pathogens that are attached in the teat canal are flushed out with the milk, right? However, when lactation ends and the dry period starts, obviously milking is stopped, and that so there's no more of that flushing effect. That teat canal closes, and in most cases, a keratin plug forms in that teat canal. Right. So this keratin plug is a physical barrier to pathogens that enter from the environment or on the teat skin, and it also has some bacteriostatic effects. So that helps prevent pathogens from entering the teat canal. Right, and then the last one is the teat sphincter. So this is a muscle that encircles the end of the teat canal, and it makes sure that the teat canal is tightly closed. So that is also a physical barrier. It limits bacterial access into the udder. Right, so if there is any trauma or injury to this teat end, or specifically to that muscle, it can result in leakage, and it can cause that teat canal to not be closed properly. And obviously then the teat canal is more vulnerable to infection, right? So be very careful when you are administering intramammary drugs that you don't damage that teat end, because that could lead to damage of that sphincter muscle, right? So have a look. I know we have some products where instead of a full insertion, you can use partial insertion, and just have a look at your technique when you are administering intramammary drugs. Okay. Okay, so moving over into the non-specific part of the udder immunity. The milk itself contains non-specific bacterial inhibitors, right? So that one of those is lactoferrin. So this is an iron binding protein, and bacteria need free iron to actually grow. So what this lactoferrin does is it binds the iron, making it less available to the bacteria, and the bacteria cannot use that free iron anymore. And so it inhibits their growth, right? So these levels are, the lactoferrin levels are the highest in the middle of the dry period. So in that period, the animals are usually more resistant to especially your coliform infections. Unfortunately, these levels do decline during the transition and the early fresh periods. So also explaining why they are more susceptible to those infections during those periods. Then there are quite a few other several non-specific bacterial inhibitors. Lactoperoxidase has antibacterial properties. There are some immunoglobulins present in the milk, especially in the colostrum. Macrophages, they are also normally present in the milk, and they act as immune cells. And their function is to recognize and engulf bacteria, and that engulfing process is called phagocytosis. Okay. Then at the entrance of the teat canal is the rosette of Furstenberg. This is just a ring of tissue. It contains lymphocytes and plasma cells that are part of the animal's immune system. And it has been shown that the mammary epithelial cells are actually very, very important in actually recognizing when something that enters the teat canal is not from there. So in other words, it is a pathogen recognition system. All right, so let's say a pathogen has managed to gain entry into the mammary gland. It's been able to cross all those physical barriers that we were talking about earlier. It is very important that the udder then recognizes that pathogen as foreign and mount a very quick immune response so that that pathogen can be eliminated as soon as possible. All right, so once that pathogen has then been identified, the epithelial cells can also then secrete certain immune factors, which leads to a whole cascade of immune response and upregulation of various factors that can then come and help in fighting the infection, right? So this rapid recruitment of immune cells out of the circulatory system into the udder is very, very important, especially when you think of infections like E. coli, where just a little bit of a delay can actually lead to quite a hefty increase in bacterial numbers. Right, so when we talk about somatic cell count, what that actually is it's an indirect measure of the mammary gland inflammation. All right, so your somatic cell count, somatic cells are mostly made up of immune system cells, such as lymphocytes, macrophages, neutrophils, and then partly epithelial cells. All right, so in broad terms, it's made up out of white blood cells and epithelial cells. Epithelial cells are the cells that line the udder that are shed especially during just the whole process of milking or during the dry period, etc. All right. So when we look at somatic cell count, usually a level of about 200,000 is considered as a threshold or a balance, right? So this can differ. Some countries regard 150,000, etc. Okay, so when we look at somatic cell count, in a healthy udder, right, the main cell is mononuclear leukocytes, right? However, so that would be your macrophages and your lymphocytes. However, as soon as that udder is infected, there's a shift in the leukocytes from mononuclear to polymorphonuclear. In other words, neutrophils. All right. And the reason for that is that these neutrophils come in and fight that infection, and they're a very important part of the inflammation and trying to get rid of that infection. All right, so they move from circulation into the milk, and that is why you see an increase in somatic cell count. It's the body's reaction to actually fighting that infection off, fighting off that infection. Okay, so it is also important to know that if there is a low somatic cell count, that does not necessarily mean that there's no infection. All right, so it is important to periodically take somatic cell counts to have a clear, a most clear picture, right? So especially, I mean, some clinical mastitis cases, you might see a big spike in somatic cell counts, and then that drops quite a bit towards the, as the infection progresses. Or sometimes with subclinical infections, you might get undulating levels of somatic cell counts. Okay, so it might be high and then go low again, and then high again and low again. Okay. Let's say there are certain cows that when an infection occurs, the increases in the somatic cell count can be quite dramatic. And these counts, we call them the millionaires, because these counts can go up to millions in terms of the somatic cell counts. And this can also occur in very severe cases of intramammary infections. All right, so you can look at an individual cow somatic cell count. That is obviously much more labor intensive and much more expensive, but it is, I mean, if we could have individual cow somatic cell count for every animal, that would, excuse me, actually just make the decision-making process in terms of our dry cow therapy so much easier. But oftentimes we only have bulk tank somatic cell count to work off, and that is the somatic cell counts in the milk combined of the herd. All right, and you can just imagine that if there is one of the millionaires in the herd can actually pull that bulk somatic cell count up quite a bit and bring the average up unnecessarily. Right, so I was talking about the polymorphonuclear cells earlier. like I said, their job is to come in and engulf and kill that pathogen to help limit the infection. But this response isn't foolproof, all right? Especially if there is immunosuppression, especially around the time of calving. Okay, so if that happens and these neutrophils are inadequate to cope with the overwhelming infection, this means that the infection cannot be eliminated. There might be some bacteria that survive and can create a subclinical infection. And it has been shown that cows vary quite significantly in the speed and degree of their polymorphonuclear response. And this depends on genetics, stress, which can lead to immunosuppression, and nutritional factors, as I'm sure Alex told you a lot about just now. Okay. So there are cases where the cow's local immune response is actually adequate and it results in a natural or spontaneous cure of the infection, which is great. However, if that inflammation is allowed to carry on for very long, or it's a severe infection, that could actually cause quite a bit of other damage. All right, so let's talk about vaccinating against mastitis just quickly. So according to I think there are about 3 vaccines on the market at the moment for vaccinating against mastitis. It's for E. coli, Staph aureus, and then I think the newest one is the strep uberis. So very important is that when you're considering managing mastitis, vaccination against mastitis is one of the tools that you can use, right? However, that it does not replace your management practices, proper milking procedures, good nutrition, etc. It's a tool that will add to all of those management practices and not a substitution. All right, so vaccination against mastitis. There's still a lot that we don't know about the immunity in the udder. So it's not necessarily going to completely prevent mastitis from occurring. But with most vaccines, it will help shorten the duration of that infection. In other words, it will limit the udder damage and then also reduce shedding. So in other words, it will help reduce the infection pressure in the environment. And that would also then help your other cows to be less likely to be exposed to this type of pathogen. All right, so this is one of our vaccines. I just want to show you an example of a program. So this program is for E. coli mastitis, and there are 3 doses that needs to be repeated annually. So we are used to, when we vaccinating cows for other diseases and they've never been vaccinated before, it's usually 1, and sometimes it needs a booster 4 to 6 weeks later, and then thereafter it's only 1 dose annually. However, with certain vaccines, it is different, and you need to read those package inserts and make sure that you know how to use these vaccines so that you can really get the best benefit out of this vaccine by using it in the right way. So this one, for example, you need your first vaccination at dry off, your second vaccination approximately 30 days later, and then your third vaccination at calving or up to 2 weeks after calving, right? And that all 3 of those doses need to be repeated annually. So this was just a study that we did, and it just showed that the duration of E. coli mastitis was reduced quite significantly in the animals that were vaccinated compared to the animals that weren't vaccinated. All right, and then also just the shedding that I was talking about, the animals that were vaccinated shed quite a significant amount less into the environment than the animals that weren't vaccinated. All right, so mastitis pathogens. So I just want to manage my time. Okay, mastitis pathogens. There are a lot of mastitis pathogens that that can lead to mastitis, but if you just start off by knowing the 5 that are on the screen there: Staph aureus, Streptococcus agalactiae, Streptococcus dysgalactiae, Strep uberus, and E. coli. I think they are quite important in terms of mastitis, right? So, but I've seen mastitis reports with pages and pages of mastitis pathogens, but these are quite important. I think another one that I could maybe add here are the CNS pathogens. They are also on the rise. So those are the coagulase negative pathogens. Okay, so let's quickly talk about gram-positive versus gram-negative. Maybe for those of you who aren't familiar with why are we calling these pathogens gram-positive or gram-negative, right? So the gram refers to a special staining technique that is used in a lab, and this stain can differentiate between bacteria, and it's based on the properties of the cell wall. All right, so they basically use different stains on the slide. So they would use a crystal violet stain, and then wash it with alcohol, and then counter stain with a red, I think it's called a safranin, I can't remember exactly, stain. And depending on the bacteria and the bacterial wall properties, it will either retain the crystal violet stain, or it will then, or not. If it doesn't retain that stain, it's washed off by the alcohol, it will retain the reddish pinkish safranin stain. All right, so and then that can be used to differentiate under a microscope. Are we dealing with a gram-positive bacteria, or are we dealing with a gram-negative bacteria? Okay, so the gram-positives will appear bluish purple, and the gram-negative ones will appear reddish pink under the microscope. Right, so I've just divided it into broadly into categories for you. So gram-positive, gram-negative, and then some other pathogens that can also cause mastitis. I think it's just important to know which pathogens fall into which category, because when you are making a decision as a veterinarian in terms of which intramammary is the most appropriate, which intramammary antibiotic is the most appropriate to use, and you do that in conjunction with the culture results, for example, and let's say it says Staphylococcus aureus, and let's say you take the package insert and it doesn't necessarily say, it doesn't necessarily list the bacteria. It usually does, but let's say it doesn't. It just says gram-positive. Then you know that it should be appropriate for that specific case. And then we can also divide it into contagious bacteria and environmental bacteria. All right, and then we have our fence sitters, which is your Strep uberus and your Strep dysgalactiae. So these, I call them fence sitters because they can be contagious, but they can also be environmental. So they have both properties. Right, so when we talk about contagious mastitis, here the chief source of infection is usually the udders of infected cows and infected milk, and it's usually associated with lactating animals. And it spreads from quarter to quarter and cow to cow, usually at milking time by contaminated milking machines or operators, or when they use washcloths or sponges on more than one animal. It can cause a chronic subclinical herd infections with those periodic clinical episodes, and also those undulating somatic cell counts. So this is quite a frustrating type of mastitis to deal with, especially if it's chronic and subclinical. And this is usually caused by 2 gram-positive bacteria, the Streptococcus agalactiae and the Staph aureus, which is definitely the more important one there. Okay, so when we're looking at control here, it would be sanitary milking and handling practices. Because remember, like I just said, it's usually carried over from one cow to the next during milking. Right, so environmental mastitis, yeah, this would usually result in a clinical mastitis, because the source of infection is usually the environment. So this would be anything from the manure, the soil, bedding, feed, water, etc. Most cases occur during the dry period, especially in the first 1 to 2 weeks, and the last, say, 2 weeks, and then early lactation. And so we'll talk about it a bit later as well, but what we see here is that a lot of the dry cow or intramammary infections that are obtained in the dry period of environmental origin often stays quiet during that dry period, and then in the first 2 weeks or sometimes up to 3 months of the next lactation, it expresses itself as clinical mastitis. Right, so yeah, the risk of exposure is unfortunately continuous. These bacteria, I mean, they can't be eliminated from the environment completely, but it is caused by a variety of bacteria, most often your gram-negative bacteria. Then once again, your gram-positive streptococci, those fence sitters, and then those coagulase negative staphylococci that I was also talking about earlier. I think that name has changed to non-aureus staphylococci. So if you see NAS, it refers to the CNS, right? Right, so contagious mastitis. This is just a summary of what I've just said. Your contagious mastitis, often on the cow skin, it sticks to that mammary tissue that multiplies inside those teats and quarters, excreted during milking, and then spread from animal to animal. Whereas your environmental mastitis, these are usually opportunists that live in the cow's environment. Like I said, difficult to eliminate. They often come in when the cow's immunity is a bit weaker, like we said, first and last 2 weeks of the dry-off period, and then right after calving. And here, the absence of that keratin plug actually increases the risk of infection. And we'll go into that a bit just now. All right, so here, when we look at the general clinical signs, your contagious mastitis, and this is very generalized, okay? So generally, if there's a high or an increase in somatic cell count, but a subclinical mastitis, that is usually then caused by a contagious mastitis pathogen. If there is no large elevation in somatic cell count, except for the initial rise, but there is a clinical mastitis, that is usually then caused by an environmental mastitis pathogen. Okay. So when we talk about subclinical mastitis, this is when there's no visible change in the udder or in the appearance of the animal. They're not systemically affected. There's no observable abnormalities in the milk. However, there is a reduced milk yield in those affected quarters. Okay. Elevated somatic cell counts, when you do a culture, you might find a mastitis pathogen. We've talked about those periodic episodes of clinical mastitis, and then chronicness, the chronicity of from one lactation to the next. Sorry, I'm laughing at myself. I've just made up a word, chronicness. All right, so usually, like I said, associated with contagious pathogens, and then how we control this is with whole herd measures. All right. So in other words, looking at the hygiene and the milking procedures, etc. Clinical mastitis, usually here there's a visible inflammation of the udder. It's usually quite a rapid onset, heat, swelling, reddening, all those signs of inflammation, hardening of the infected quarters. You'll also see visible abnormalities in the milk, clots, flakiness, discoloration. It can be preceded by subclinical mastitis, and in acute cases where the animals are systemically affected, they can have fever, they go off their feed, reduced rumination, dehydration, weakness, depression, etc. And then that noticeable milk drop, right? quite variable incidence. Some animals might not be affected at all, and some animals might have constant clinical mastitis, and then this can be quite fatal. Literally, animals are fine in the morning and dead in the afternoon. All right. And here we will look at treatment as usually on an individual cow basis. Right, so another general guideline, not necessarily going to be the same in every scenario, but just generally, if you look at the average bulk tank somatic cell count, if it's less than 200,000 or more than 200,000, and you look at the number of cases of clinical mastitis per 100 cows per year. All right, so if that is 25 more or less. So remember what we said. Obviously, we want a somatic cell count less than 200,000, and we want less than 25 cases of clinical mastitis per 100 cows per year. But if the somatic cell count is lowish but the clinical mastitis cases are high, once again, we're looking towards environmental bacteria. If the somatic cell count is high, but the number of clinical cases is not that high, you might be looking at a contagious bacteria. And then if both are high, it's either a combination infection or you might be dealing with one of those chronic mastitis cases. Okay, so just quickly, let's look at the consequences of mastitis. It can have quite significant consequences on the reproductive performance in animals and dairy cows. So I'm not going to go through everything on the screen, but you can just see here that the overall effect is that there's delayed days to service, there's increased days to conception, and it requires more services per conception. And all in all, that means that there's an impaired reproductive performance. Right, looking at milk quality. So on the screen there, you will see this is the major components generally of normal milk, right? So this will differ between different breeds, etc. But just in general, normal milk, lactose 4.8%, all right? So that's the milk sugar that's unique to the mammary gland. It's a major carbohydrate in the milk, all right, and readily digestible. Protein, where casein is the major component, and that's at 3.3%, give or take. Fat, 3.5, give or take. And then we have our minerals that I'm sure Alex covered. And then the major component is then water, right? So in the case of an intramammary infection, the milk production will drop, but also the composition will change. And how that will change is we'll go into that just now, but the appearance of the milk might change. So remember we talked about the watery milk, the clots, the discoloration. Talking about the milk production drop, it can also reduce the total fat production, right? And then interestingly, they've seen that milk yield can decline by 2.5% for every somatic cell count increase of 100,000 cells per mole above 200,000. All right, so, and you can just imagine, because your older cows are the ones with higher production, if they are losing production, it can be twofold greater than those first lactation heifers. All right. Right, so we've just spoken about the components of the milk, and when there's an intramammary infection, it can also result in a decline or a change, a shift in the normal milk components and an increase in components derived from the blood because of the animal's body's the immune system is trying to protect the udder. All right, so we've spoken about milk protein. The casein levels actually decrease due to an enzyme called pepsin, and that results in poorer milk quality. Milk casein is especially important in cheese and yogurt production, and so if those levels are decreased, it can negatively impact the yield of those non-milk dairy products. Lactose synthesis also decreases. like I said, it was the major carb in the milk. When those trying to maintain that osmolality, when those lactose levels fall, it actually causes the udder to pull sodium and chloride into the udder by trying to maintain that osmolality. And that can then, because of that sodium and chloride that's being drawn into the udder, it can give the milk a bitter or a salty taste. All right. The levels of lipase also increases, and that's the reason for that milk fat being oxidized. And when that happens, it can give the milk a rancid or an off flavor. And then obviously we've spoken about the immunoglobulins and the albumin that come in from the circulatory system and increases that somatic cell count. Okay. So let's quickly talk about treatment during lactation. So I've said antibiotics with a question mark because there is more pressure on veterinarians to make sure that antibiotics are indicated for, before they actually advise the use thereof, right? And then when we do look at antibiotics, we are looking at gram-positive versus gram-negative, in other words, broad spectrum versus narrow spectrum. We are looking at, would we want to give an intramammary antibiotic, or are we only going to give a parenteral antibiotic? In other words, parenteral, for those who's not familiar with the word, is systemic, so in most cases here injectable. And then anti-inflammatories. There's definitely a place for anti-inflammatories. Important there just to check for safety in pregnant animals. All right. Right, so the veterinarian here plays a massively important role. And I think it's very important for a dairy farmer to have a very good relationship with their vet. And here the vet will look at the treatment strategy based on the pathogens that are responsible for the problem, right? They will also look at the history on the farm. They will look at the culture results. There's a whole lot of information that the veterinarian will look at before they make the decision on which intramammary product to use. All right. And another reason why the vet here is so important is that it has happened to people that that don't necessarily make use of vet or don't consult their vet on the correct intramammary to use, and then they use the incorrect intramammary for the problem. It doesn't solve the problem, or it's not necessarily, it doesn't necessarily kills enough of the pathogens, and there's a section of them that survives, and then that leads to a chronic mastitis. Or worst case scenario also is that the incorrect product is used in terms of that some people have by accident used a dry cow therapy instead of a lactating cow therapy. And we're going to talk about dry cow therapy just now, but that means milk discard for a very, very, very long period. Okay, so the vet could also do a culture, do an antibiogram, in other words, showing how sensitive the bacteria is to certain antibiotics. This is a great starting point, but these results cannot always promise you treatment success, right? So what is seen in field is not always the same. All right, so when we look at intramammary infusion products, these, once again, it must be the correct product for the infection. How easy is it to administer? What is the doses required and the time between doses, and does it fit in with the production system? In other words, a twice a day milking versus 3 times a day milking, etc. What is the milk discard time required? That is also very important. And then I've put pre-slaughter period in here. Obviously, we're working with dairy cows, but this is for, let's say, in cases of an emergency slaughter. All right, so let's talk about the dry period. All right, so here, this is very important. I don't know who actually started with this saying. I know who said it to me. But But then I heard someone else say it the other day, and I asked them, like, did Dr. Chris van Dijk say this to you? And then they said, no, it was someone else. So I don't know who this quote belongs to, but it says the dry period isn't the end of the previous lactation, but rather the start of the next lactation. All right, so that's very, very important to not just let our dry cows just after we've given them the dry cow therapy that we give them, you know, as in the picture, they walk off and then you see them, you know, at the end of the dry period again. Okay, it's important to look after the dry cow as well, because what you do in the dry period will actually help you or benefit you quite a bit in the next lactation. All right, so remember, the dry period starts at the end of lactation, so we've stopped milking, right? These cells are still quite engorged with milk. There is still quite a lot of pressure there, all right? The milk is then eventually resorbed back into the alveolus cells, and the purpose of the dry period is that the damaged cells are replaced by cell turnover and renewal. All right, so that is very important. In addition, new secretory tissue is formed. All right, so not only are you healing the udder, but you're also gaining more secretory tissue. All right, so it goes without saying that this period is really critical for maximum milk secretion. All right, so when we look at the dry period, there are 3 phases. The first phase, just after milking, is what we call the involution phase. So here the udder is more susceptible to infection. Remember what I just said, that milk flow stops, and it depends from farm to farm whether it stops abruptly or whether they sort of take it over a few days. But in the end, there's no more flushing of bacteria, and that pressure that buildup of milk can compromise the teat canal. All right, so in the middle phase of the dry period, when the udder is regarded as involuted, in other words, it's gone through that whole process macroscopically as well as microscopically. Here it is quite regarded as relatively resistant to infection. Those protective factors that we were talking about earlier, like the lactoferrin, is present there. The teat canal is hopefully closed by a keratin plug. All right, and then the last bit of the dry period we call colostrogenesis, or the transition period. So here the udder becomes more susceptible to infection again, right? So those protective factors start decreasing. The keratin plug, if it was formed, starts breaking down, and depending on the antibiotic, the levels might start falling below where it is protective. Okay. So remember what I said earlier as well, it can be that an infection is actually gained in the dry period and it remains silent until calving. So a lot of the mastitis cases that we see in early lactation were actually acquired during the dry period. Okay. So this is just to show you those high risk periods again. If you respond better to pictures, like I do. So the start of the dry period, the end of the dry period, and then the first bit just after calving as well, right? And this is also just to show you in a graph form how infections that were actually acquired during the dry period can then manifest themselves during lactation, all right? And so you'll see, especially in the first 3 months of lactation, a lot of those infections were actually acquired during the dry period, and even up to 8 months of lactation, the infection was actually acquired, you know, very few amounts, but it can actually happen up to the 8th month. Right, so when we look at the mastitis decision tree for a dry cow, most farmers in South Africa actually just are using blanket therapy. In other words, all the cows are just receiving an antibiotic dry cow therapy. We are seeing more and more farmers that are more interested in selective dry cow therapy. In other words, they are, you know, more selective in terms of which animals actually should receive an antibiotic dry cow therapy and which of them shouldn't. And then we have farmers that are also now starting to use internal teat sealants or a combination of an antibiotic dry cow therapy and an internal teat sealant. Right, so just quickly to just describe to you the differences between an antibiotic dry cow therapy and an internal teat sealant. So your antibiotic dry cow therapy, and remember we're talking about dry cows now, is to treat existing mastitis, where your internal teat sealant will help prevent new intramammary infections from the environment during the dry period. Right. It does not contain any antibiotics. Obviously, your antibiotic dry cow therapy would. And it does, an internal teat sealant usually does not have a milk withdrawal. You do need to strip it out, but there's no additional milk withdrawal after that. All right. And then it will not have a direct effect on the somatic cell count like an antibiotic would, but I said that it might have an indirect effect in terms of, you know, helping to prevent those new intramammary infections from entering the udder. All right. So when we talk about an antibiotic dry cow therapy, these antibiotics are formulated to actually have quite a long effect and to penetrate deeper into the udder tissue. And that is why it is especially important to make sure that you don't give these dry cow therapies during lactation, okay? Because of that long-acting effect and the deeper penetration, it can actually, and obviously the longer milk withdrawal period, okay? All right, so what we're trying to do is we're treating existing infections, and then also we're trying to promote the general health of that udder and hopefully the formation of a natural keratin plug. All right. Okay, so when we are trying to prevent new infections during the dry-off period, I think I've stated my case and why this is important to do, because you don't want those clinical mastitis cases in the dry period. You also don't want them to stay quiet and then only manifest in the first few months of lactation. All right, and how we protect the udder during the dry period, one of these is by sealing that teat canal with the formation of the keratin plug that I spoke about at the beginning of my presentation. Then this keratin plug is a physical barrier, and it also contains bacteriostatic components. All right, so if that keratin plug does not form, it actually can leave the teat quite vulnerable to infection. All right. So one New Zealand study showed that about 50% of the teats in the study were still open 10 days after drying off, and 5% of teats were still open 60 days after drying off. That's often, that can be longer than some people's dry period on their farm, all right? Another study showed that you can expect slower teat closure in higher producing animals, and that 23.4% of these teats were still open after 6 weeks, which is also pretty much the entire dry period. And they found that udders with closed teat canals, in other words, udders that formed a keratin plug, were almost twice less likely to develop a new infection during the dry period. Okay. Internal teat sealants, what is it? It is a bismuth subnitrate paste, all right? And it's it's the last thing that you put into the udder it's antibiotics first, and then you seal the udder with the internal teat sealant, goes without saying. And that then sinks to the lower part of the teat canal. It remains there until you strip it out or it's removed by the suckling calf. There's no adverse effects to the calf. And it mimics that keratin plug. So it forms a physical barrier to the bacteria entering and causing that infection. Right? It doesn't harden or set. A lot of people ask us, oh, but now I've put it in. What if I see there's an infection now? You strip it out. Okay, it's not like a permanent plug that you put in there. Remember, I said it's non-antibiotic, so it cannot kill bacteria or cure an infection that's already in the udder. So therefore, cows with a suspected mastitis should not be treated with an internal teat sealant only. It's also very important that hygiene, the strict hygiene measures is used in very aseptic techniques when you do use an internal teat sealant. But actually, this goes for any intramammary. You should be working as hygienically as possible, so that you aren't introducing extra pathogens into the teat canal during intramammary administration. Okay. So what are we using teat sealants for? I think it's pretty explanatory, but self-explanatory. But we're trying to protect the quarter from new infections from the environment during the dry period, especially in those animals that have open teat canals at the beginning or at the end of the dry period. All right, so it can also help extend the period of protection, especially when you use it with an antibiotic dry cow therapy, especially if you have quite a long dry period and the antibiotic dry cow therapy can only work for so long. I think it explains it nicely in this slide. Yes, so let's say your dry period is quite long. Your antibiotic dry cow therapy only has a certain amount of time that it can work, right? And then the levels start waning. But then at least if you have used an internal teat sealant, in that last bit where the udder can be a bit more vulnerable or can be vulnerable as those antibiotic levels decline, the internal teat sealant is still there, protecting the udder from the environmental bacteria. All right, so just to quickly, there's a lot of information and a lot of studies done on internal teat sealant and its use and its effectivity, etc. So just to quote this meta-analysis, they did it in Australia in 2013, and they studied the effect of internal teat sealants on intramammary infections, clinical mastitis, as well as somatic cell counts in their animals, right? So what they found for intramammary infections is by using an internal teat sealant, either by itself or along with an antibiotic dry cow therapy, reduce the risk of lactating animals acquiring new infections by 25%. So in other words, if it's used during the dry period, it reduces the risk of, when those animals start lactating, acquiring new infections by 25%. Compared to just using an antibiotic dry cow therapy. And then when they used internal teat sealants by itself, compared to animals that did not receive anything, so no teat sealant, no antibiotic dry cow therapy, it reduced the risk of intramammary infections by 73%. Right. So then looking at the next one, the clinical mastitis, they found that, the use of internal teat sealants, once again by itself or along with a dry cow therapy, reduce the risk of clinical mastitis by 29% compared to just using an antibiotic dry cow therapy. And then when it was used by itself, compared to animals that did not receive any treatment, it reduced the risk of clinical mastitis by 48%. All right. So I've mentioned the increasing concern over antibiotics, especially in our food-producing animals. So very important that we have a strategic and a focused approach, especially when it comes to the use of antibiotics, to work closely with our vets to make sure that we are using the correct antibiotics, whether it's dry cow therapy or lactating cow therapy. And also, just to make sure that, if we are using the correct products, that we will be looking after our animals in the best possible way and hopefully get a cure in the fastest possible way. Okay. So just quickly, I mentioned selective dry cow therapy briefly earlier, and this is when those farmers, oftentimes there are a few things that you can use. And that's a whole talk by itself. But if you are more interested in, how do you go about selective dry cow therapy, there are quite a few steps. And it's usually you look at the herd and then you look at the group of animals and then you go down to individual cows. So you would need something like individual cow somatic cell counts, but we've also seen that there are other tests and measures that you can use with relative safety to know which animals you can put, let's say, an internal teat sealant only, or an internal teat sealant and an antibiotic dry cow therapy, and then whether you should use a narrow spectrum or a broad spectrum. So there's quite a lot to consider, and it is quite a bit more admin, but it's really, I mean, you would then be a very good antibiotic steward when it comes to selective dry cow therapy, especially the pressure of antibiotic resistance, antimicrobial resistance that that everyone across the world is experiencing. More pressure from consumers, governments, etc., on the use of antibiotics. And then obviously also just from an economic standpoint, if you can save in certain instances, but not compromising the animal's welfare, that would be, I mean, the best scenario. All right. Okay, so once again, there is really a lot of references, especially when it comes to internal teeth sealants. And if you have any further questions that we don't handle here today, you're welcome to take down my email address and just pop me an email. Right, and I think that's my story. Thank you.
Thank you so much, Chantelle. If anyone has a question, they can just raise their hand or put it in the chat box. I don't see anything else, but we'll just give a moment for them to type it out if they have any questions.
I think everyone's hungry.
Okay, so there is a question just came through. So when using both intramammary and systematic antibiotics to treat mastitis, would you recommend using the same active?
Yeah, I think that would probably be the best. If you can, if possible. We have products that you can use the same active. But yeah, it depends on it depends on the actives and it depends on the bacteria. But yeah, I think if you can use the same actives and you know that is the active that would work, that would be the best. If you are a veterinarian and you would like to know more about our products, we do have, for example, products that contain oh my word, I've just gone blank. Amoxicillin clavulanic acid, sorry, that you can use both intramammary and systemically.
And then there's another question that's a bit long. So I don't know if you want to read through the chat with me, but good afternoon. How would you systematically attack or treat Staph aureus coming through in your milking herd? For example, I sent off 17 mastitis samples for bacteria type, and 3 out of the 17 were positive for Staph aureus. The remaining were Strep uberis. Would you recommend testing the whole herd individually to see what the infection rate you are dealing with, or tailor your treatment accordingly, also bearing in mind that it's a long process due to the shedding and etc. with multiple testing going forward to weed out Staph aureus animals? If you cannot elaborate due to time, please make it an email. So
yeah, I think maybe we should do that. You can definitely, I had my email on the screen now, but I can maybe just type it in here. I think with any type of mastitis problem, like I said earlier, I think it is so important to get your veterinarian involved. Your veterinarian or your consultant can come to your farm and have a look at everything, right? So remember what we said about Staph aureus, it's contagious bacteria. So they would have to look at, let me just see here. So I just want to see your question again. So they would have to look at everything, right? So everything from, they would stand with your milkers and see how are they milking, what are they doing, what are the small changes that they can make even from the milking table. right, and then going on in terms of what are we gonna do with these animals that are, having these periodic mastitis cases. It is, especially, your vet can come in and actually palpate the udders and see, which of these animals have those, those microabscesses or scarring, etc., caused by the bacteria, and then look at their somatic cell counts. Is it, and then make the decision whether it is better to keep that animal in the herd or not. And then obviously, then going from there and looking at, should we be testing every single animal, which animals are most at risk, and we're only testing those animals, etc. So, excuse me, it is quite, I think it is quite an intensive process. So I think we can maybe take this over email as well.
Okay, and then Corinne just asked, there goes the question. Would a CMT be able to assist with individual dry cow therapy, or is it unreliable?
You can. I will send you some information. Corinne, I don't know if you don't mind, maybe you can just send me an email, and then I can just send you some information that we have available on that CMT.
Okay, and then Michael also asked, he said milk is the most ancient nutrition for mammals by creation. Has the introduction of antibiotics and therapies perfected the commodity or predisposed cows and made them vulnerable to multi-drug resistance? Now, with larger, fewer herds, how can we revert to the most natural way of mastitis-free reduced infection in South Africa context? We're emulating the Netherlands.
Let me just read the question myself. So I think when we talk about antibiotics, yeah, I mean, if I understand your question, have we predisposed cows and made them vulnerable to multi-drug resistance? So, I mean, it's not necessarily the cow that is resistant to the drug, it's the bacteria, right? So, but if I understand your question correctly, now we've created this scenario where there is multi-drug resistance, and this now, obviously causes the animals to be vulnerable. I think there's a fine line, in my opinion. I think we can't just leave animals to suffer if they have an infection, and we need to actually treat them from a welfare standpoint as well. So I don't know, maybe that I went too quickly over that slide, but there's a saying that says using antibiotics as much as necessary, but as little as possible. So that we treat the infection, but we don't compromise the welfare of the animals, but we're also we're still being good stewards of that antibiotic, and not just throwing any antibiotic at the animal, but really using it in the most correct way, and using the correct antibiotic for the problem. All right, so the most natural way of mastitis-free or reduced infections in South African context, emulating the Netherlands, I assume you're talking about selective dry cow therapy in the Netherlands. I'm not sure exactly what you're referring to. But yes, I think there is a small, even though we are far behind, but there is definitely a shift in mindset. And I think more people are looking towards, especially going, say, from a broad spectrum to a more narrow spectrum, looking towards internal TTNs. We have all the tools. I think it's just our responsibility to actually use those tools and to try see if we can go towards more selective dry cow therapy. There are obviously obstacles as well. There is a fear of not necessarily, no, not everyone, but there is a fear of not using an antibiotic during a dry cow period. You know, what will happen? And I think there the question is the risk of treating an infected animal versus treating an uninfected animal. You know, there's a lot to consider, especially when we're talking about selective dry cow therapy. But yeah, I think the wheels are turning slowly, but they are at least turning. And yeah, I think forums like this, where we could actually talk about this, you know, will also help our farmers and our vets to, you know, move the mindset towards, you know, more selective dry cow therapy. I hope that answers your question.